Hello, I'm Claire Matata, and I'm the lead author of the CPT article on encephalitis, what the nurse needs to know. A bit of background about myself. I'm a registered adult nurse with experience in thoracic surgery, prison nursing, community nursing, research nursing. I've also worked in an Ebola treatment centre and in urgent care. I've also just completed my master's degree in clinical research. When I wrote this article, I was working as a specialist research nurse in neurological infectious diseases, a post that I had for over 3 years. So I was encountering lots of patients with suspected, probable and confirmed encephalitis. I've been involved in the care of patients with both viral and autoimmune causes of encephalitis and have experience of assisting with diagnostic lumbar punctures for these patients. I also encountered patients that, due to acute confusion caused by encephalitis, a diagnostic lumbar puncture had to be carried out using a best interest policy and the assent of their relatives due to the patient temporarily not having capacity to consent. It was from this work that my interest in the nursing care of patients with brain infections really stemmed, and my master's work focused on the challenges faced by nurses when caring for patients with acute encephalitis. I think that this subject is important for nurses because although encephalitis is a rare condition, patients suffering with it require intense nursing care. As many nurses do not have direct experience of encephalitis, many of them aren't aware of what it actually is and how it can manifest. This topic is also really important because of how important it is that treatment is administered quickly in order to give patients the best chance possible of both survival and of having fewer long-term complications. Some of the challenges for nurses when caring for patients with encephalitis includes getting a diagnosis in the first place. Many patients don't, and this can be difficult for both the patient and their loved ones. These patients may also suffer from acute confusion and will often need full nursing care, including assistance with activities of daily living, as well as making sure that their safety is maintained. Poor staffing levels in many clinical areas can hamper nurses' efforts to provide optimum care in these areas. There is also the issue of access to appropriate rehabilitation once they're discharged from hospital. In the article, I found it important to highlight the difference between meningitis and encephalitis. Meningitis is infection of the lining of the brain, the meninges, whereas encephalitis is infection of the brain tissue itself. I also tried to highlight the high levels of mortality and long-term neurological complications that these patients can suffer from. Whilst working concurrently on some research for my master's degree on the challenges that nurses face when caring for these patients, I interviewed several nurses who stated lack of knowledge about the condition as a problem. It's important that nurses work closely with other disciplines to ensure that patients with encephalitis are given the best care possible. Nurses need to work closely with the medical team to ensure that a diagnosis is made if possible, and to ensure that the patient and their loved ones are as well informed as they can be. However, the other healthcare disciplines really do play an important role as well. Access to good physiotherapy is vital, as is input from occupational therapy services. Dietitian advice may also be required if the patient is unable to meet their own nutritional requirements. I hope that the article covers what you as a nurse need to know about acute encephalitis.